5, 4. Well, hello, folks. Welcome to Radio FM88 Australia. And we're broadcasting from the Springwood studios in Brisbane, Queensland, Australia. And welcome to the streaming side of things, where you can actually now watch it on Facebook or YouTube. And then later on, you'll be able to catch up and watch the show on Spotify, iHeartRadio, Amazon, Google, and Apple. So at this particular time and point, I'd like to introduce to our co-host, who's sitting right atop at the very top. Of course, that's in the Northern Hemisphere too. So it's a welcome to Andrena.
Hi, Jeffrey. Welcome to everybody dreaming the new dream. And today it's our pleasure to have Alan Payne from the UK. So welcome, Alan. And it's lovely to have you on the show.
Thank you for asking me.
Yeah, my pleasure. So we'll start at the beginning. I met you through my sister Carol, and you were giving a talk on health and wellness at the PLG, and Carol had written you a poem which she presented to you afterwards, and then you two connected, and Carol thought you would be a great person to have on the show. So anyway, next thing was you and I met up with Carol, and here we are today. So that's how it started. So you are all about health and wellness through herbs, naturopathic, iridology.
Yes.
So what got you on this path? And I got lots of different questions from different friends have said, oh, ask about this or that. So would you like to share where you were born and how you started to get on this lovely path of health and wellness naturally?
Yes, of course. I was born in the Midlands of England, near Birmingham, and I always, I suppose from about 8 years of age, I had an interest in health and welfare at a sort of minor level. Never had any aspirations to become a doctor or anything like that. Working class family and pretty happy childhood. But from about 8, 9 years of age, I well remember carrying around with me a tin of, it used to contain a tin of toffees, but I put in it ointments and plasters, what the people in Australia, I think, call Band-Aids, and different concoctions. And if a friend fell over or bruised anything, I'd be there with my little tin of medications. And so I had that sort of minor interest from a very early age. But very briefly, I went into commerce, the furniture industry, and decided by the time I was getting on for 40 years of age that I wanted to change. And change is the only constant, really, isn't it? If you want to move on, you have to make the effort and the changes. So for the next few years, I went self-employed as a furniture agent, and I was able to take time off to study herbal medicine and then iridology, and that took a few years. So I was doing the studying and the working, keeping the mortgage going, all that sort of thing. When I eventually qualified, I qualified at the College of Herbs and Natural Healing, which was in Norfolk. And after 3 or 4 years of being a qualified therapist, they asked me to teach for them, which I did, lectured for them to their students. And it went on from there. I learned iridology, but I realized that the course I'd been on wasn't that good, really. So I went abroad, America, Spain, and learned from some very knowledgeable people, and then wrote my own iridology course, which I've been teaching ever since.
Oh, brilliant.
I've taught at various colleges and places like where Eden Project in Cornwall, and the different colleges and institutions around the world. Done a lot of work in Singapore, working with Chinese doctors and lecturing to their people. That's where I end up now, doing seeing patients and doing lectures and courses and things like that.
Because I know you're very popular in Glastonbury. A few of my friends have already seen you when I shared your photo and what have you.
Okay.
They've all said lovely man, and well impressed with your knowledge and what have you.
Very
So I know now more than ever, for me, it's how I can help people to do things naturally,
Yes.
as and when they can. So where would you like to start? Would you like to start on herbs? I mean, the thing is, there's so many different things out there that do so many different things. And I know, like we were talking earlier about a picture of somebody's eye that I'd sent you. And really, I know that you need that person in front of you to get the maximum benefit. So, it's just like, well, there was something on the eye that was quite sharp. It wasn't a little blob or anything. So I'm thinking, well, all of these things have reasons, I mean, it's like there's just so many natural things like, reflexology and all of these things which are keys to the body. So where would you start with maybe the herbs? Let's start. No, I've gone on to the eyes. There's so many things I want to ask you about both. So we'll go back to the eyes. So when somebody comes to you, obviously do you take a picture, or you're looking in with your little microscope and having a close look? How do you work?
An iridology consultation lasts about an hour and a quarter. And the first thing I do is take a case history and decide what the patient actually wants to achieve. Sometimes they want to help with headaches or sleep problems or arthritic problems, things like that. And we decide the way forward. Many times today, I get people who just want an assessment to see what more they could do to help their health in the future. People want to grow to a good old age, but they want to be healthy in those years. Yeah. Definitely. So we can help people do that. I think I wouldn't really start with iridology or herbs. I'd start with our ethos. I'd start with the way I and people who are trained in the same way as me, we like to work. That is to encourage people to take charge of their own health. I mean, if they need to see a doctor, absolutely fine. They should always see a doctor if they have a health challenge. That's fine. But there's always things people can do for themselves. And many people today would choose an alternative practitioner rather than a doctor. And they need to have that choice. But the ethos really is to do with simplicity. That is finding the root cause of a problem. And with my training, of course, it's the iridology and the general questioning that will help us with that. The simplicity, after that comes the change. Iridology, for instance, will tell me what a person's constitution is, where their strengths and their potential weaknesses are, and what they should do about those potential weaknesses. For instance, I might see some liver signs. Those liver signs could indicate that the person has migraines, digestive upsets, hormonal imbalances. So we need to use the signs in the eyes to ask the correct questions, and the answers we get will tell us where we are with that person. The signs in the eyes will also tell me which herbs and which protocols would be really useful for people. And then I would, during the consultation, to answer your question more fully, after taking a profile of the person, I will look in the eyes with an illuminated lens. That only takes a few seconds. And then I like to photograph the eyes and show them side by side on the computer and explain the signs to the person. First of all, their constitutional traits. Obviously, we're all here, so the people who came before us, parents, grandparents, etc., they did something right, at least until the time they could reproduce. So people have mainly got strength showing in their eyes, but all of us have some deviations from that. All of us have some potential weaknesses. The signs I see in the eyes are not actual illness signs. Iridology is not diagnostic in the way a blood test would be or a liver function test would be, but it's an assessment of the chi energy in those eyes, the life energy in those eyes. And it's very easy to see someone's constitution from an iridology perspective. After that, of course, we will talk in the consultation about the way forward, whether people should have things like bowel cleanses, liver cleanses, kidney cleanses, or simple herbs just to help them to take away pain and inflammation, and what they can do in the next years in order to optimize health. And that's what it's all about. I mean, we all have lots of challenges these days. Back in my youth, I noticed that a lot of people around me, friends and family members, some, you know, they were always ill, and some were always well, and others were dying early. You know, I'd got my father died at 59 and another close relative at 58. And when I looked at the lifestyle of these people, it became obvious that the people who were having more, taking care, more care of their lifestyles were living much longer. You know, my mother lived well into her 90s, so did one of her sisters, my grandparents, and they had lives which were not perfect. The diets and the lifestyles weren't perfect by any means, but they sort of tipped the balance in their favor, and they lived long and healthily, you know. So then we would come on to the herbal medicine. The body, you know, has this innate way of making us well. We have a cut and it mends, you know. We have an imbalance in the hormones, and the body can, given the right circumstances, readjust it. But all of the things around us these days, more than ever when I was a youth even, we've got this barrage of additives in food, of Wi-Fi. I don't know what these... Yesterday overhead we had chemtrails. I don't know what they're doing to us at all, or what they're for. But mainly it's things that people use, like the plastics that get put into the food, and the colorants and the chemicals that we don't really need. Even things like shampoo and hair dyes and things like that. They have chemicals in, you know, that the manufacturers don't even have to put on the packaging. And a lot of these are rather unhealthy to the body. And, you know, I can well remember a circumstance where I asked a lady to stop using the hair dye, and her facial blemishes all went, you know. It can be that simple. So that's where I am with it. It's a matter of finding the root cause of a problem, helping people to make the change. And the really big thing is encouraging people, with help of various practitioners, to take responsibility for their own health. Okay, see the doctor, see the surgeon, that's fine. But do what you can to help yourself. And it can be simple things, very, very simple things. Like instead of having anti-inflammatories from the doctor, many people would do a herbal compress onto a painful joint or something like that. You know, it's a choice. It's a choice. You know, talk to the doctor and make your decision. Talk to your naturopathic health carer and make the decision which might be best for you. That's the way it works in a nutshell.
No, I'm totally with you. So yeah. Right, talking about herbs, because obviously it would be nice for people, because I know, like you say, there's additives, there's all sorts of stuff in food now, which, I mean, you see some people now that are so overweight, more that you see it more than ever now. And, you know, you see people really struggling, and obviously the diet plays a major part, and you have to be radical to go back to basics, really, and get on the natural things and change your lifestyle if you choose. And it's, you know, again, it's people's choices where they go with things. So what would you start? Like I was saying earlier, like I like to make nettle tea. My kids think my kids might think I'm weird and wacky when I come with my concoctions, but that's okay. So nettle tea and dandelion tea, and I
Yes.
really played much with other things. And then rosehip syrup, I know is good for colds and coughs. So what would
Yes.
you say for people to start if they wanted to make little changes? What would be easy, simply things that would help to lightly cleanse their system out, whatever they've got going on?
Yes, I think it's best if people aren't used to this work that they should start with simple things and don't overwhelm their bodies with doing 20 different things in the same week. I think it's best to start and be easy on yourself, and then you won't be thrown off and you'll keep up with the regime. But to answer your question correctly would be to say that I would tell people what they need to do individually. For instance, my herbal formulas, I have none pre-made. I have all the bottles of herbs that I need to make individual herbal formulas. So
and that's the key, isn't it?
Say again?
That's the key, isn't it? It's tailor-made to suit the person.
Yes, the iridology individualizes everything. I show my iridology students pictures of the eyes of identical twin sisters. Now, each of these sisters had migraines, but when we looked at the eyes, there were slight differences in their eyes, although you couldn't tell them apart. There were slight differences in their eyes, which said that one sister needed this formula and another sister needed a slightly different formula. You see? So even identical twin sisters have individual needs. And I just can't be doing with people who have herbal formulas on the shelf and they give one formula for the nervous system and one formula for the hormonal system. I cannot deal like that at all. It has to be individual. So the advice, to answer your question, the advice I'd give people would be individual advice. I saw someone, a lovely husband and wife, on Sunday in my clinic in Lichfield, and I gave the gentleman some advice on how to get rid of an inflammation in the main joint of his thumb. The next person I might give slightly different information to. Yeah. The lady had a gastric reflux, GORD, they call it GORD, problems, and I was able to give her individual advice for that. I was tidy up her diet and tell her what to take to alleviate the symptoms and eventually help to take the problem away, really. So it's very, very individual. Sometimes people they say they're depressed, and sometimes one cup of chamomile tea gives them a good night's sleep, and next day they're much better. It can't be that easy.
So if I was to say to you, I'm coming to you for a session, and if I was to say, what can I do now to improve my health so that I'm able to be active and fully out and about doing what I'm doing? So would you recommend consultation about herbs, or would you do the eyes first? What would be your way of working?
It's always with the eyes first. Right. Well, first of all, really, is coming to a decision what that person wants to achieve. And of course, therapists are really assessing the person from the first handshake. I look at the face, the facial signs, the body posture, etc. But it would be iridology first. That lays the ground, and then the advice, including herbal medicine, which I can supply or people can buy their own if they have a trusted source. That would be the way to do it. The only thing I ever say to people is, if you're going to get your own herbs, make sure that they're organic or wildcrafted or very good quality. Make sure that they're not too old. Some of the herbs on the shelves in the shops can be years old. And they lose their power, you see, over time. And make sure that the herbs are the right strength. A lot of the herbal liquid herbs on the shop shelves are tinctures, which are fine. Many herbs I use are tinctures, but most of the herbs I use are fluid extracts, which are several times stronger than the than the tinctures you buy over the counter, you know.
Mm.
So I like to make sure that people are getting good quality as possible with their herbal medicine. And then we decide, or I decide, what formula. It might be a single herb in a bottle. It might be as many as 4 or 5 herbs in a bottle. I don't really like to put more than that amount in one bottle. I know some cultures, Chinese herbs, Ayurvedic herbs, they're very good, very good programs for people, but they tend to have a lot of herbs in one formula, and I don't really agree with that, you know.
Yeah.
And then we assess the progress. People often phone me up, maybe have a second consultation, maybe have a phone call consultation, and decide whether to leave them on the same regime, tell them what else they can do, because, you know, they often say, well, I'm feeling better, what else can I do? You know, there's always something else you can do. And then I'll post out more herbs or a reformulated formula, and see how they go on from that, and just keep contact with the people as much as they need. Yeah.
And I think that, like you say, the difference is somebody starts taking something and you don't realize what level your body or how you're feeling until you take some herbal medicine that you've made.
That's
And then
right.
and it gives them a lift in their spirit, let alone their body. And obviously then they think, well, I'd like more of this, what else can I do? Because you're on that cycle then of feeling better, aren't you?
You are. I mean, you mentioned earlier tiredness. The last 2 years I've had appreciable percentage more people with certain illnesses. Tiredness is the big one. Lethargy, not being able to start the day or get through a day. I've had many more ladies with hormonal problems than ever before, for whatever reason. But with the tiredness, you see, an iridologist would look into a person's eyes and they would be able to assess what is the cause of that tiredness. Is it toxicity? Maybe it's something like certain signs in their eyes which would show what the doctors call anemia. You know, we need to get more iron into the body, but not more iron itself into the body. We need to get the body to utilize the iron that they've got. Very often that's a problem. And it's a very clear sign, 2 clear signs in the iris that would tell me that. Or it might be life energy. You know, kidney energy is life energy, and they might have signs to say that if I give this person a kidney pick-me-up, they'll feel an awful lot better. You know, and there are other things as well to do with tiredness, of course. Yeah. It could be a sleep problem. Maybe they're not getting deep enough sleep. Maybe their sleep pattern doesn't go down from alpha to theta waves, so they might sleep but not really well, you know, and that can be quite easily dealt with. Yeah, the tiredness might be due to a lot of intermuscular tension. That takes an awful lot of energy, you know. So some herbs which release that tension would be good. Maybe the liver needs a little bit of TLC, so a nice liver tonic, because the liver is a major organ and it takes an awful lot of energy. And if it's not working to its best potential, and a little bit of TLC, tell them, you know, maybe what foods to avoid for a week or 2, and give them some lovely liver herbs, mild liver herbs maybe, they'll feel an awful lot better. And people come to me, you know, I say, well, I didn't tell you about this, but it's gone away. I'm sleeping better. My nails seem stronger. My libido is better. You know, all that sort of thing happens when we do some balancing work with people.
And I know, like, you know, we've had COVID and lots of people like to make choices that they wouldn't have chosen, you know, through different situations. So are you finding people are asking something to help balance their system out with what's been put in?
Well, yes, definitely. I've had a few people who have had minor neurological problems that the doctor has usually said leave it, it'll go away, or things like that, because it's very difficult at the moment, certainly in the Midlands, to get to see a neurologist for whatever reason. But I had one gentleman recently with a minor facial paralysis that we had to do something about, and it looked to me as though it might have been going into what's called Bell's palsy. So we've sort of alleviated that, hopefully. One of my relatives in Australia had similar problems, but more intense problems. And yes, they did have, let's say, certain medical interventions that they didn't really want to have. I have a suspicion, actually it was confirmed by a patient of mine who is actually a chemist. It's amazing how many people I see who are chemists and nurses and, you know, into healthcare at that allopathic level. But this chemist had hormonal problems, and she was very insistent that it was caused by the medical intervention that she had. Now, I don't know whether she's correct or not, but she was very insistent that she had no such problems before that medical intervention. But it's not only people who have gone down that path, and I understand why they make the choices, but it's people who haven't had those medical interventions. That's the only way I can put it. Some people are showing a lot of tiredness anyway. So there are other causes, lifestyle, stress, overwork, that sort of thing. But I just wonder about what's going on around us with, as I said earlier, yesterday there were lots of chemtrails over this area. I'm just not sure what they're doing, and I'm not sure that we're being told everything. But, you know, I don't want to get into that.
Quite. Yeah, that's going off on another tangent, but I do have to say that I've been blessed to have come. I've had nearly 2 weeks in Cyprus, and the sky was blue every day. I never saw, and on the odd appearance, a cloud passed by. Total opposite to here. It's like, oh my God. But anyway, yeah. So, and it's in, you know, it's in the water as well.
The water, yes.
You know, I bought a distiller, and my God, you know, from the tap and spring waters, what's left at the bottom, I think, and you know, people have got well, some people have, but you know, you can use the ordinary water, like the Brita filters, but this is like going on one step on, and when it's gone through the system and you see what's left behind, I think it's flipping out.
It's terrible. It's awful. And from you know, maybe 5 liters of water, you distill it, and there could be as much as 1/4 of an inch of sludge at the bottom of your kettle.
Yeah,
you know,
I know.
That's all problematical to the kidneys more than anywhere else, you know, and people don't realize this. And you've got the fluoride, which I absolutely hate, you know. No, I don't go near tap water.
No, quite. Yeah. So, and it's educating people, you know, the best way you can, easily and affordably as well. So, so I know you've got some pictures of some herbs. So do you want to talk about some of the pictures that you sent in?
Yes, I think it might be slightly advantageous to talk about the iridology slides first.
All right. Okay. Yeah. Like I said, I love it all. So it's like, oh, a bit of this, a bit of that. So
yes.
So I can see like a black speck. It's say nearly 3 o'clock. So is that toxins? Is that a toxin, would you say? Or
could we enlarge it slightly more? No, that's a pigment.
Right.
Yep, that is a thank you. That's fine. That is a pigment.
Yeah.
If we had an iridology map in front of us, so the iridology map is very well known by reflexologists, you know, with their hand and their feet map and that sort of thing. And but our map is a little bit more constitutional. Now that pigment is in an area which it's in the pulmonary. It's in the lower lung area in the lobe of the left lung. It looks as though on the photograph. That is a blockage of energy. As I said earlier, we all are alive because we have energy flowing through our body, ki, chi, prana, whatever you want to call it. Now, when the energy reaches that pigment, it stutters a little bit. It's like a sticky area. The energy doesn't flow too well. That does not mean that there's a problem with the lungs. It's a potential problem. So people with that that pigment on a physical level, it could mean they maybe a simpler thing as they tend to shallow breathe, but it could also mean a tendency to bronchitis, or you get a cold and it flies to the lung every year. The energy is not there to throw these things off, you see. There are a few other things, but I'm using herbs and iridology both physically and metaphysically. So that's more or less the physical meaning of that herb in a very simplified, of that pigment in a very simplified way. But metaphysically, it's in an area which is what we call the grief area. People who have that pigment very often hang on to old grief and grievances. They also have a tendency not to like people to get too close to them. They hold their cards very close to their chest. So you see, we can help people with metaphysical aspects of iridology as well. Just below that pigment, just to the left of that pigment, can you point to that? Yes, just there. Yes, just there. There's a hole. Very common. I've got a lot of these. That hole is called, thank you, that hole is called a lacuna. The very tiny ones are called crypts. That lacuna, again, is not an indication of any illness, but it's an inherited potential for lack of energy in that area. So the chi energy flows around the body, or it's going well. It reaches that area and it gets a little bit dissipated, a little bit disrupted. So if that person has a lifestyle which disrupts that energy any further, the person could have problems in that area. And it's actually in the heart area. It looks from this angle, it's probably the left ventricle, the left atrium in the heart. That does not mean to say they've got a heart problem, but it's more likely if they have a lifestyle which doesn't support heart energy that they would get a problem. Metaphysically, it's rather a nice sign to have. It's very often it means a courage sign. People go through life with a lot of courage. It's also a sign for empathy for other people and a few other things. If you go further down, there's a whole, this lacuna. Yes, there. Yeah, that is in the area for the solar plexus. Now, just outside the heart area, the solar plexus has a lot of uses, really, mostly to do with the digestive system and metaphysical signs again. Many a persons come to me with a diagnosis from the doctor of irritable bowel syndrome, and I see that sign and I treat the solar plexus energy, and the nerve energy to the bowels gets better and the problem goes away. So I would like to see more doctors on my iridology courses, but in the last 30 years, I've only ever had 2 doctors. Yeah, so that's the type of thing that can be assessed, but it's the constitution which is important. Could we maybe, Jeff, put one of the blue-grey eyes up?
Can I ask you why the orange? I mean, the other ones are going to come, but why all that browny orange color? What's all that about?
Yeah, no problem. Pupil is called an area of, it's all pigmentation, you see. So it's called central because it's in the middle, heterochromia, which means opposite color. That heterochromia gives me a lot of questions to ask. It's a minor blockage on energy in the digestive system. For some reason, people with that sign, especially ladies, are very much more prone to fungal infection, Candida albicans overgrowth and so on in the digestive system. It sort of makes a 5-star hotel for that particular fungus. That's just percentage wise, but it's also a sign metaphysically of implosion of life energy, in that these people again, and this matches the pigment that we saw earlier to some extent, these people are sort of drawn inwards in their ability to go through life. They're quite private people normally, and one or two other things, but those are the main ones. Now here we have that's fine. This is fine. This eye is a part of about 50. I've got this type of eye. About 15% of the world population has this type of eye in color, blue-gray. We call those lymphatic eyes. The eye we saw previously is called a mixed eye or biliary eye, and the very dark brown eyes, which don't photograph very well, so you don't have any samples, they're called hematogenic, very difficult to photograph clearly. These lymphatic eyes, blue-gray eyes, constitutionally the person has a tendency towards problems with their lymph system, as the name implies. Their kidneys tend to be a little bit more problematical as time goes on. They have problems with mucous membranes. Now, we can all see those little clouds around the edge of the eye. Those clouds go by several different names. The one I like to use is tophi. They're little flocculations, and they indicate certainly a part, certainly of the outer lymph system. Now, when that person was young, those clouds would have been white, very definitely white. Now they're going a little bit darker, a little bit creamy colored. That shows that at this time in their life, this person's lymph system is under a little bit of strain, and we need to give them maybe herbs to help that. Certainly several lifestyle tips on how to help the lymph system: exercise, trampolining, swimming, skin brushing, hot and cold repetitions in the shower, that sort of thing. And they can pick and choose and see which one suits them, but their lymph system really needs to be upgraded a little bit. Then they feel better in all sorts of ways. Their immune system will be suddenly much better. Their energy will suddenly be much better, you see. If you look at 6 o'clock in that eye, there, yeah, you see that dark line, yeah, and all that area, if people half close their eyes, they'll see it. All that area is a little bit darker. This is typical of this eye. This is the area for the kidney. If you reduce the photo a little bit, Jeff, please, I'll tell you which eye it is. Well, yeah, it's obviously the right eye. So this person's right kidney maybe at times will need a little bit of tender loving care. We need to tell them how to look after their kidneys with, avoiding too much acid making foods and that type of thing. And maybe give them a little bit of a kidney boost with herbal medicine as part of the wider treatment that they're getting. That dark area is I'm oversimplifying really, but other iridologists, if they're watching this, will know that I'm oversimplifying, but that's the general plan of action really, to help the lymph system and the kidneys. If this person came to see me with a skin problem, then yes, we would need absolutely to treat the kidneys and the lymph system. Yeah.
I think this is a female because the eyelashes seem to be a lot darker. So would that signify if they're doing makeup?
It's actually it's actually someone who's quite famous in the UK. She's a TV presenter, and I can't identify her. Obviously, we don't identify patients, but I did a live iridology program, a short program, part of a health program for Granada Television. I don't know how long ago, a long time ago, maybe about 20 years ago. And this was the show's presenter. And it's a very, very female, I assure you, very lovely female. Yeah.
Okay, so my point of making is that mascara, does that play a problem there? Is that mascara, does that play a problem?
Yes. Well, I absolutely don't know about makeup, but I think it could well be about mascara, yes. Yeah.
Yeah, because the eyes are the most, they can heal themselves a lot quicker than any other organ. So I was just wondering when you get some pigment within the eye, you know, and I just wondered, did makeup, can that cause an issue there for the health reasons? That's all.
No, not well, not to cause the pigments. They can cause problems. Definitely can cause problems. But the pigments are released from pigment releasing cells in the iris. Years ago, they used to be called psoric spots, which means itch spots. And the iridologists in those days, who were mainly doctors, by the way, they believed that these pigments were caused by toxins, mercury and excess iron and things like that. They're not. That's a misnomer. But even some modern iridology books will still state that fact, but I can assure you that's not the cause. You don't cause the pigments, you inherit the pigments. And some pigments can arrive up until the early 20s, but rarely after that. Oh, this is an interesting one. This is, again, it's a grey eye, it's a lymphatic eye. But now, instead of having little clouds around the edge, we now have this big band of colour sort of more towards the pupil. This brings the person, still lymphatic eye, but it brings the person into the category called uric acid diathesis. Again, they've done nothing wrong. It's a family thing. It's a big thing in my family, for both my mother's side of the family and my father's. And it indicates that this person is not great with acidic food or stress. Stress makes acid in the body. This person will retain acid wastes, and that leads to mainly two things: tendency to joint inflammation and acid crystals in the joints, which would be like gout or arthritic, rheumatic type problems. And the other thing is acid reflux, digestive system acidity, big things with this type of person. Many people come to me with this sign because it's a very Western sign, Scandinavian type eyes, Germanic type eyes. We go for this colour mainly. And this person really usually has a very acidic diet, and they come with all the associated problems. If they're unlucky, they get the digestive and the joint problems, like I saw it on Sunday, you know. Okay, well, this is fine, but with your permission, can we go to the other blue eye that we haven't seen yet? That would be a better start. Yes. Yeah. Oh, no. Oh, yes, this one will do fine. If we look at this eye, again, it's a lymphatic eye, but look at the fibers which radiate out from the pupil. They are very straight and quite tight. Now, I've seen straighter, I've seen tighter, but this brings this person into a subtype called neurogenic, or nervous system orientated. It doesn't mean they're a nervy person. They're not necessarily a wallflower type person, but they are a person whose nervous system has an awful lot of control over their body, or they need to control their nervous system. It can be a very good sign. People with these straight type fibers are often entrepreneurial, captains of industry. They make very good collators of information, therefore they make good bosses. They make wonderful employees. If I would want to employ someone who will turn up for work, even if they've got a sprained wrist or a cold, or if they will work the hours you want them to, this is the type of person. The downside is that they live life in the fast lane and they don't always see the brick wall. You know, many people with this type of eye come to me and say, I don't know why I'm here. My partner sent me, or my mother said I should. And 10 minutes later, you found 5 good reasons why they should be there. I bet. They plow on. They need usually they need minimal sleep and minimal rest, and they're always on the go. They're active. Now, if we can go back to that other eye that you showed me previously. Yeah, that's the one. Oh, there we go. Few herbs.
Hey, that one?
No, next one. Yeah, no, next one. No, next one. That's it. If you could please enlarge that. This is the opposite. It's not worse. With iridology, there are no good eyes or bad eyes. It depends on what you do with what you inherited or what you've caused. And most of the signs in the eyes, 95% or more, are inherited. Now, this is,
Really?
yeah, oh yes. And this is the exact opposite to the previous eye, the straight lined eye. Those lines are called trabeculae. Now, in this eye, you can't really see very many. There are some in the background, and they're very loose and they're very wavy. Iridologists call this eye by several names. The one I like is loose connective tissue. The connective tissue in our body, it's the muscles and the even the blood flow and the blood pressure. It's all part of the whole connective tissue. But, you know, ligaments, and people with this type of eye, they need lots of rest. Without their rest, they are terrible. They tend to be very laid back people, hippie types, if you like. They go through life in a very casual way, which has its great advantages. But they do need their rest, and things like vitamins, minerals, they tend to get lost very easily from the tissues in this type of person. They will present with things like prolapsed uterus more than the other type, foot arch problems more than the other type. They will go out for a run and step off the pavement and sprain an ankle much easier than the other type. Now, it doesn't mean to say that they're weak. It means to say that they need considered and regular strength building protocol. I worked for a place in the Midlands where the owner and his son had this very type of eye, and yet they had very, very strong bodies, but they were in their gym every day. You see, you have to build up and keep the strength going in this type of eye. Now, the main differences with the metaphysically with the two eyes, the person with the straight lines in their eyes, if I give them a herbal medicine and say, please take 30 drops 3 times a day, they will do that. And probably at the same time every day, because they are very, very precise thinking people. This person being more laid back, they'll phone me up and I say, how are you doing? And they say, fine, hopefully. And I say, oh, I'll send you more medicine. And they say, well, I've still got half a bottle. You know, they haven't taken the right amount. They tend to be very enthusiastic while they're in the consultation, but they lose enthusiasm afterwards. So this type of person, I will often phone up after a few days, not wait for them to phone me, because that's probably not going to happen. And I will tell them, you know, please tell me what's happening, how are you doing, encourage them to take the herbs, etc. So it's patient management in that way.
Yeah. Can I ask about bloodshot eyes? Because
I don't know this virus at all, actually. Yeah, go on.
Yeah, so with bloodshot eyes, I mean, you know, you see, I know, like in the past, I've woken up and my eyes have been quite bloodshot, and I know ages ago, and I'm not sure because I had a whiplash injury, but I woke up one morning and one of my eyes was completely black, and my God, everybody looked at me. I looked like something out of blooming Dracula, but you know, I just opened my eye and it was just like so bloodshot.
Yeah.
So, well, I mean, obviously various causes.
Yes, various causes. It's a bit of a mystery, really, for most people, because it doesn't seem to have many pointers to what the cause would be. You know, not at all. No, there are herbs which would, you know, I would tend, looking at the person's eyes first, of course, but I would tend to aim to get rid of that with helping the lymph system in that area, really. You know. The lymph nodes.
Yeah, because I know at the time I'd seen the optician, and then I went back a couple of days later and I said, can you tell me why this? And she said, oh, it's funny, we've had a lot of people come in with bloodshot eyes. And I thought,
strange,
thanks a bunch.
Yeah. It's strange the way that happens. Yeah.
Okay, so have we finished with eyes at the moment?
For me, yes. The last slide that went up wasn't one of mine, so I don't know.
Okay.
If you want to talk about that one, I could try, but you know, Yeah. Okay. So we have mainly lymphatic eye. The fibers are quite straight, very straight in parts. This shows someone who is a big thinker, a doer. This shows someone who will make a project and follow it through. The whiteness looks as though it could well be uric acid, so some dietary considerations. Can you see those white fibers in the head area? Those are indications of overthinking. Now, I can't see from the photograph whether this is a left eye or a right eye. No real clues from the iris. The pupil position suggests that it's right eye, but I wouldn't be certain about that. The pigment that we can see at about 5 to the hour, that's a liver pigment. Yeah. Now, if this is higher up at the
top 5 to 12.
Yeah, 5-2. That's it. That's a liver. That's called a liver pigment by its color. Now, if we go down to the bottom section of the iris, can you see those two dark lines at sort of 25 to the hour and 20 to the hour?
Yeah.
Yeah. Well, those border the main liver area if this is a right iris, not if it's the left iris. That would mean that I would be looking very closely at the liver of this person and asking certain questions. The pigment which is at 25 past the hour, low down on the, that's right, that one there. I'm not going to talk about that because that is in a very personal area, and I don't know who this person is, and it would need to be a one-to-one for that. I don't want to, because you might know who this person is, and I don't want to give out personal details. But it's a very personal area of the iris, but it's meaningful. It's meaningful in a way which tells me this person should be doing some protection for certain parts of their body. I'll say no more. Right. But this is a thinker, a doer, an overthinker. If this was the left eye, I would like to see the left eye, if possible, to look at the spleen area, because with this type of eye, the spleen is often compromised and needs a little bit of help. I think that's about all I can say for this one. Very strong, very strong fibers in most areas, good resistance to illness, good recovery powers. Nice one. All in all, quite a good, quite a good format. Yeah.
Okay, herbs. Right. So Andrew's put his own eyes change color.
Yeah.
Any information about that, please?
Yes. The color changes are normally because of pupil size. That pigmentation, the blue or the any brown pigments, brown areas in the eye, they've got nowhere to go. If the pupil gets big, those areas get squashed. So the blue gets bluer. Light brown pigment tends to squash up and look browner. Pigmentation around the pupil, like the one we saw earlier, the central heterochromia, that gets squashed and the pupil sort of changes color. That's normally all it is. So if the person were to be in a dull light, the eyes will tend to look darker. Sometimes, of course, well, partly because the pupil will look a bit bigger anyway. And if the person then looks outside the window at the daylight or switches a light on, the pupil reaction will be to go smaller, and the pupil being smaller will make the iris generally look lighter. That's normally the only way to look at that. Perfectly normal. Perfectly normal.
Interesting, eh? Right. You got some herb pictures, I believe.
Yes, yeah, we have.
Can we touch on herbs?
Oh, that's the lovely cleavers. My friend Felicity, I work with in Glastonbury, we went to walk around the base of the Tor and found cleavers growing, proliferating. It's been wonderful this summer. And we gathered some and soaked it overnight and drank cleavers water with our breakfast next morning. Very invigorating. Yeah. That little herb is a wonderful herb for, and again, this isn't personal advice, you know, but for most people's lymph system, for those blue-grey eyes, do very well with cleavers. It's a mild herb, very, very few contraindications, and wonderful just to push the lymph system along a little bit, just to encourage it, not to force it. You know, if someone needs lymph system help because they've got flu or something, we need something a bit stronger than cleavers. But for everyday use, this one would be very, very helpful. You know, the lady with those clouds around the edge of the eye, which were going from white to creamy coloured, this would be a fine herb for that lady. Fine herb. It's very, very mild herb, very, very useful every day. You can use it long term, and you can buy it, of course, but you can collect it certainly in Glastonbury. You can collect it wild. People grow it for its uses. Really, really good lymphatic system herb. Very good for the kidney energy in a mild way. Yeah, kidney energy.
So what do you advise? Just, you know, obviously washing it and boiling it up for how long would you boil it up?
You don't need to boil it. If you pick it fresh, you can just the flowering tops. The roots aren't much use, but the flowering tops you could just chop it, and chop it finely and pour hot water over it. Cover it. Put it in a pot, or if you're using a mug, just cover the mug and stir it occasionally. And 10 minutes later, you're drinking a lovely cleavers tea. That's a tisane or a herbal tea. If you use the root of a plant, such as burdock, that's fine, but you can't just put hot water on. You need to boil it and simmer it, because the root has a bit more resistance to letting its useful chemicals out. You know, you need to boil it up. And the bark of a tree, you see, we use some barks, oak bark and so on. You would need to boil it. And in many cases, it would be better to have a tincture of those. But with the cleavers, you can just pour hot water onto it. If you go to a herbal supplier, and there's several in Glastonbury, you can buy dried cleavers tea. And it depends on the age of it and the strength of it, but a teaspoonful in a mug and just pour hot water on it and strain it off after 10 minutes, and you've got a wonderful cleavers tea. Yeah.
I have to try that. I haven't tried that one.
Yeah.
And I know some of the herb teas you buy in the packets. I've never tasted such awful tasting.
No, they're very often not really herbal teas.
Yeah.
If you break some of their sachets open, you get a little bit of herbal leaf or whatever, and a whole host of acid crystals, you know. And they're not the best. They're not the best. No. This herb is one of my top 10, really. It's meadowsweet. Meadowsweet. We use the flowering tops. Again, the root isn't much use. Meadowsweet. It's called Queen of the Meadow. When I lived in Norwich, we grew a lot of herbs, and this one overhung the pond. It loves to be near and overhanging water. And when I first did my first ever herbal lesson, it was a wonderful classroom. It was farmland in Norfolk. What a classroom. And my great teacher, Jill Rosemary Davis, she had us take our little field books and go out and find 3 herbs each, I think we had to do. And the first one I found was meadowsweet. And it was overlying a stream, and I had to take my shoes and socks off and wade in to get a good look at the flowers. And I took a sample back. Always ask the plant for permission, of course. And I took a sample back and found that this was indeed meadowsweet. It's called Queen of the Meadow. It's also wort. That's one of the old names for it. And the reason for that is that when a bride was in church for her wedding, these churches hundreds of years ago, they would have earthen floors, and maybe people didn't smell quite as sweet in those days, and they used to strew this herb on the floor, so that as people walked on it, the wonderful, very individual scent of the meadowsweet, it rose up, and the whole situation became a little bit better with the scent. So it was called brideswort, but it really is a wonderful herb. It's actually one of two herbs which were the precursor of aspirin. It comes from the spirea family, and spirea is the word which gives aspirin its name. The other one, of course, is white willow, which is sort of part of the same family, strangely enough. Most people would tell you that white willow is the original herb that aspirin was derived from, but in actual fact, my research says that it was meadowsweet. Meadowsweet is very good for taking old acidity from the body. It's very good for certain digestive problems. A lot of people I know have this digestive problem of acid reflux, and a little bit of meadowsweet tea or meadowsweet tincture diluted can be very good for that. But it's part of my everyday. I mean, I use a lot of meadowsweet because I get a lot of arthritic and gouty and acid indigestion problems, and this one goes into any formula that I can justify it, with other herbs. And it partners well with white willow, it partners well with nettle, it partners well with silver birch, which is a herb that a lot of herbalists don't use these days. It's a bit old-fashioned, but I love it. And it really takes away inflammation, both in the digestive system and certainly in the joints. Just a wonderful, mild herb that does what it says it will do. Yeah, lovely. Yeah.
The leaf, I'm looking at that leaf there, and I thought, I've seen that leaf pattern before, and I just realised it's in the Boy Scouts Girl Guides, isn't it?
Oh yes, and not dissimilar to the Canadian
maple. Yeah,
maple. Although the maple has very distinctive spikes on the leaf. If you look at that leaf, you've got all these deep veins. You've got the little serrations. Now, if you look at the bottom of the leaf, if you go to the bottom there, now you can see some little leaflets. Yeah, tiny leaves, and that is a distinct identification mark for meadowsweet. You get these flowers which are in these bunches. Some of these formations are called umbelliferae. They're umbrella shaped, like wild carrot and things like that. They're umbrella shaped. This isn't quite umbelliferae, but it's getting on that way. And you get these little florets and little bunches, and you get that deep veined, mainly three-pronged leaf with these little leaflets, and you've got meadowsweet. But if I was blindfolded and you held meadowsweet beneath my nose, I would know it absolutely 100%. It's got such a beautiful fragrance and very individual fragrance. I just love it. If I'm using it, I smell the bottle every time. I just love it. Yeah. Lovely herb. Oh, yes. Well, vervain. Yeah, that's vervain. This is a UK vervain. There are various ones. The Latin name for this one is Verbena officinalis. Some books list it as Verbena hastatus, but these days we use the suffix officinalis. Again, it's a very popular herb with me. I get a lot of people with certain signs in their eyes, which mostly they were born with, but they make worse. And these are signs. We don't have any on those photographs. I can't show you, but these are signs of intramuscular tension, which can put blood pressure up, can cause headaches and migraines, can make people feel tired, all sorts of things. And my go-to herb is vervain. Vervain takes tension out of muscles. Now, I usually use it with another herb, which is, I'm not going to mention because it's herbalist only herb. And I use maybe 95% vervain, maybe 5% of this other herb, and they work well with each other. But it's no point in me mentioning the name of the other herb because it's a class 2 herb, which is a herbalist herb, which can have many contraindications, so we have to check people out before we give it. But the vervain is quite a easy to use herb. You can't use it during pregnancy because it's a uterine stimulant, but it actually helps ladies, well, men as well if they need to, but ladies to uptake. It's not estrogenic, but it helps people to uptake estrogen more easily. So I use it in some formulas for hormonal balancing, but also it's this taking the tension out of the body that matters. I've had a spate of people with migraines, and at least a couple of them in recent weeks I've given vervain to, because part of their migraine causes was tension in the body, and it's good. It really works very, very well indeed. I love it, absolutely love it. I visited a friend of mine, a herbalist, lovely herbalist and iridologist, Tom Williams, in near Cardiff. I visited him, and the vervain was growing in his driveway, and he said, "Oh, I drive over it, it keeps coming back." very, very stalwart herb. Yeah. So that's this one is nettle. A little visitor there with the ladybird. Nettle you mentioned earlier, Andrena.
Yeah. No, I love nettle tea.
Well, most people in my trade consider nettle as the prime, or at least close to being the best nutritional herb. It contains an awful lot of vitamins, minerals, and trace elements. I like it for certain situations because it contains a little bit of silica, which helps strengthen the body in various ways, which I won't go into at the moment. But silica is a good product, a good product to take into the body with certain problems, often to do with the kidney and urinary system. Nettle is what used to be called a blood cleanser. That's a misnomer. In a way, it does help blood quality. It helps the blood to get rid of toxins, and it's a herb which is wide range of uses. Metaphysically, it's great. If people are having problems in surviving a situation, it helps them. Nettle is a survivor. It puts its roots down on barren ground, many feet into the soil, and finds what it needs in terms of moisture and nutrients. It's a survivor. It will grow virtually anywhere. And metaphysically, it will help people to survive a situation. You know, they're caught in a bit of a bind, and they drink some nettle tea and things tend to feel better. Yeah, it's a survivor. And it's I remember last winter I had an awful journey to Glastonbury in the rain on the motorway and the hail, and instead of a 3-hour journey, it was like 6 hours, and I'd got a full day next day. And my friend Felicity, who's wonderful with the food, she's a lovely lady to work with. And I got in there and I was exhausted and not looking forward to the next day. And this was early evening. And she made me some nettle and potato soup, a little bit of garlic in there. And after 2 bowls of nettle and potato soup, I could jump a 5-bar gate.
Really?
Absolutely true. All my energy came back. All my spirit came back. The motorway was forgotten. I was ready for a good night's sleep and a day of patience next day.
We'll have to have the recipe for that then, I reckon.
It's wonderful herb. Yeah.
Right. Andrew's saying he's growing elderberry trees, and how would you use the flowers and berries for general benefits?
Well, I used to. I haven't lately, but friends I have done. We take the flowers in the spring, put them into vegetable glycerine in a jar, keep them. Take the berries in the autumn or whenever it's flowering, whichever country you're in, and wash them and clean them and put them in with the flowers, and then maybe put a little bit of alcohol in, maybe brandy, a little bit of brandy in, and then a few weeks later you've got a wonderful extract of elderberry flower and berry for colds and flus and sore throats and that type of thing. Now, I've got elderflower tincture here, and I use it a lot for sinus congestion. I actually use it with another herb, which sadly we haven't got pictures of, called goldenrod. Now, goldenrod and elderberry, well, the flower of the elder, they work together very well in various proportions for sinus congestion and sinus problems generally. If there's a sinus infection, I'll use that combination, but I'll put something like maybe echinacea in, or baptisia, something to help take away the infection. So that's the way I mainly use these herbs.
So you mentioned you had top 10 of herbs. So what would be your maybe top 3?
Oh, that's really difficult. I mean, the top one is always the one that's working at the time, you know.
All right. Well, fair enough.
You know, there are so many categories and so many uses that I suppose if there were 3 that I wouldn't want to be without, they would be herbs which would help with maybe emergencies and sort of one size fits all, like for the immune system, echinacea. That would be really, really good. Goldenrod, I mentioned a minute or 2 ago. I'd hate to be without that. In fact, I'm a little bit worried about that herb, running out of it. At any one time, I've got 3 litres of that herb in my dispensary. If I get below 3 litres, I get a bit panicky. That and vervain, I think the vervain would be number 3, just off the top of my head.
Right.
And those are herbs which I keep a lot of in case supplies go short. Yeah. But, you know, I've got like 60 top 10 herbs, you know. It's
I bet. On my travels, I've picked up some lovely herb books. And when I move from this space, then I want to play and dabble with more herbs. So, so you've mentioned you're doing a herb course in Glastonbury in September, which I put my name down for. So when is your next, for people that want to have a consultation with you, when are you next in Glastonbury? Is it next weekend, did you say?
Yes, the next time would be Friday the 18th and Saturday the 19th, possibly, only possibly, Sunday the 20th. Although that's my granddaughter's 8th birthday, so yeah.
Oh, you might have to be doing your party bit.
I might be doing the granddad bit, yeah.
All right, that's brilliant.
Yeah. And then I'll be back again at the end of the month. To be honest, I've been so busy recent months that whereas I used to go to Glastonbury once a month for 2-3 days, I'm now going every fortnight for 2 or 3 days. You know, it's really, 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 really busy. Yeah.
Fabulous. Well, I think I'll book in a session with you when you're down and when I'm down as well, just to see how I'm doing and how I can keep improving my health along the way.
All good. Excellent.
Okay, so you've got some herb courses coming up or workshops, and you've also got iridology, which I'll be interested in. So so best for people just to email you for the information.
Yes, please do. Yeah.
Right.
Yeah.
Okay. All right. Well, we put your email up address, and it's in the information, so people can contact you directly and make an appointment and book in. So, excellent. Right. Is there any last words of wisdom you'd like to share before we
Words
end?
Words of wisdom. I think really going back to an hour or so ago, in reality, you know, change is the only constant. We're changing all the time, and we have to sort of go with the flow of that. And if I would really give my best piece of advice, is to realize that you can be the solution to your health problems. You can make the choices you make today will benefit you or cause you problems tomorrow, you know. So to live as long as possible, but also as well as possible, just realize that it's in your hands, really.
Totally.
So is this,
with you.
It's come up on Google to say this is goldenrod. Is this the one you're talking about?
It looks like it, yes. There are one or two plants which are very similar, but that does, thank you for that, that does look like goldenrod.
Right, okay.
My picture isn't as clear as I would like, and the leaves aren't as clear as I would like, but I'm 90% sure. But there are similar herbs. That's why you need to learn to identify herbs correctly. Yeah.
Brilliant. Okay, well,
Okay.
thank you very much.
You're very
Did you want to
welcome.
ask anything, Jeff?
Yeah, I'll do as a matter of fact. So obviously our audience is global. So
Yeah.
we've got your email there that we've put up, so they can contact you.
Yeah.
Now,
Yeah.
I'll just do that again. So for the Australian, New Zealand, American, Canada, Europe audience, well, Singapore, Malaysia, can they come through and do what we're just doing now through Skype, or and you just can you do an online session with them?
Sadly, no, because to do my best work, I need to see people's eyes clearly, and just photographs aren't, they're two-dimensional. They're not really 100% useful. I need to see the person in the flesh. I need to see the eye in all its glory, you know, three-dimensionally and from different angles. So it's not the way I could possibly do my best work.
Okay, that's okay.
But, you know, people should really contact different associations, herbal iridology associations, and find qualified practitioners really in their own. It's not really possible to do a fully useful consultation. I do occasionally do telephone consultations. Obviously, I can't do iridology consultations over the telephone, but I do occasionally do telephone consultations, especially if people want really urgent help with something, you know. But no, generally it's people I can see face to face. Yeah.
Okay. Right. Well, thank you very, very, very much for being our guest this week. It's been an absolute delight. I've really enjoyed, you know, all the information that you've shared and all the advice. So I look forward to seeing you soon down in Glastonbury.
I look forward to it too. And thanks once again for having me on.
No, it's our pleasure.
You're welcome.
So thank you everybody for tuning in, and same time next week for another amazing guest.
Very good.